thousands seniors who are receiving free preventative services. I'm not ready to give that up. Repeal's not an answer. Improving is an answer, and I'll work with you. But we don't use this vehicle as a reason to stop government from running, or a vehicle to stop us from paying America's bills. It goes on and on. 6,200 young people who now qualify to stay on their parents' policies for their health care coverage. This is vast improvement. This is allowing people, the tens of millions who have been uninsured, the many who are underinsured, to finally have access, connection to a system. Aren't we in this business to respond to the needs of people? Are we in the business to take the facts, twist them, present them in a way that offer confusion and only serve political partisan purposes? I think we can do better than that in this chamber. We're going to work. We're going to get to that finish line. And I'm convinced, Representative Garamendi, that we're going to stand for justice, what's for fairness in our society. And health care is a right. We should see it as an American right. The moral compass points in that direction. And we ought not use it as a pawn in a political theater that allows for us to not have government funded or allows for us to not pay our bills. Let's get on with business. What's happening in this chamber? Are we so insensitive to the needs of people? What could be more important than responding to the health care needs of the people of this great country? So let's stop the brinksmanship. Let's get it done. Let's get business done here. And I thank you for leading us in this discussion and
Mr. Tonko,
having served with all of our colleagues here.
Thank you very much, Mr. Tonko. In previous weeks, you and I and Mr. Ryan and Mr. Castro have had the pleasure of talking on this floor about putting people to work, about jobs, about creating the infrastructure, the education, the training that's necessary to move Americans. But this week we find ourselves caught up in this leveraging the necessity of funding government and paying our bills, the debt limit, using that as a lever to destroy a very important law that provides benefits, real benefits to every American. Mr. Castro, we thank you for joining us. We know that Texas was much discussed in the previous hour. Sure. I'm sure that you have some thoughts about all of this, and so please join us. Thank you very much.
Thank you, Congressman Garamendi, and thank you, Congressman Tonko and Congressman Ryan, for your very eloquent words in describing the situation that we face today. I, like millions of Americans, hope that there will not be a government shutdown. I hope that we can get past the hostage politics that have prevailed over this place over the last few years. This is no way to run a government. Our nation is the strongest nation on earth. We are the most exceptional nation on earth. And these wounds are self-inflicted ones. I've said many times, and I've heard from my constituents, that all of these fiscal fights, these self-inflicted wounds by Congress, when we get up to the limit where we're supposed to pass a budget or we're supposed to raise the debt ceiling limit, all of these fights are causing the nation high blood pressure. They're affecting the market in negative ways. The stock market is taking a hit. Our employment rates are taking a hit. In every way, this has been bad for the country. And I would also remind our members of Congress and the American people about what happened the last time brinksmanship was tried. The last time this happened, the sequester resulted. A bad way to do business. I think people on both sides of the aisle would agree that the sequester did not turn out well for our nation. Well, that's the same road we're headed down again. The Republicans are taking us down the same road that gave us the sequester, the Budget Control Act, and then the cuts that really were across the board, were not targeted, have hurt the military, have hurt education, have hurt health care, and we're headed down the same road. You know, and Congressman, last time you and I spoke, I guess about a month ago here on the floor, I mentioned that, you know, in politics you're often asked, whether you're a Republican or a Democrat, what is it that you stand for? And I think as Democrats, what we believe in is that there are a few things that have made this nation great. First is freedom, because we are a free people. That freedom has been hard fought for. I come from San Antonio, Texas, military city, USA. So the people of San Antonio and the people of Texas know the high price of freedom. The second is democracy. We are a democratic nation. Because we are free, we get to elect our leaders, and we get to kick them out of office when we no longer believe that they're representing our views and our values. But much of the politics of today is really fought over the third principle and value, which is opportunity. You see, what is special about this country, and the reason that for years and years people from all over the world have wanted to come to America, is because as Americans, we have come together to build out what I call an infrastructure of opportunity that enables each of us to pursue our American dreams. And I want to remind you what I mean by that. Just as there's an infrastructure of transportation, a system of streets and roads and highways that helps all of us get to where we want to go on the road, in American society, we have built up together an infrastructure of opportunity that enables each of us, or at least helps us, get to where we want to go in life. And that has to include certain things that are at risk when we get into hostage politics. Great public schools and universities, a strong health care system so that if you get sick, you don't become debilitated or die, and then an economy that's built around well-paying jobs so that people can support themselves and their family members. It's that second part that I mentioned, health care, that it has been an issue in this debate. And I just want to close by saying this. The senator from Texas, the junior senator from Texas, a few days ago, talked about how he was speaking for 26 million Texans when he was threatening to shut down the government over the Affordable Care Act, which he derisively calls Obamacare. He does not speak for 26 million Texans. The fact is, Texas has the highest percentage of people who have no health care coverage at all. There are a lot of families who are having to take their kids to the emergency room, who are getting letters from their insurance companies because they've hit their lifetime cap. They're getting letters being denied coverage because they have a pre-existing condition. The Affordable Care Act is going to change that. It's going to be a good thing for our state. And so I would just note that there are a lot of people in Texas who are excited about the Affordable Care Act and the fact that they are going to have a chance to afford to have insurance, some of them for the first time in their lives. And even those who have insurance, many of them will no longer have to worry about being denied because of pre-existing condition, about hitting a lifetime cap, or about going bankrupt because of health care. So with that, Congressman, I yield back.
Thank you very much, Mr. Castro, and thank you for pointing out that one junior senator doesn't represent all of Texas, but I know you represent the heart of Texas.
Thank you.
That is the people of Texas. We're joined here by our distinguished senior member from the state of New Jersey. Please, thank you for that. But before you begin, may I inquire how much time we have?
9 minutes remaining.
Very good. Please.
Thank you. I just want to thank the gentleman